So basically, yesterday we talked about basic details of RBC and functions, okay, and production and maturation. Today we will talk about lifespan. So what is the lifespan of RBC? Okay, RBC minimally lives 120 days. Okay, 120 days is the average lifespan of every RBC. Okay, then after what will happen? Fragile. So they will constrict, their body will have different types of shape will happen. Okay, and we have one system that is microphages system. Okay, microphages system means the system will eat this dead tissues. Okay, this is the macrophage system because number of dead cells, number of cells will die daily. Okay, lakhs of cells will die if it is not, if it is not able to remove from the body. What will happen? Toxic substance will create. Okay, so that's the reason God gave us one system, that is microphage system, which will eat the dead tissues. Okay, macrophages means big eaters. What is the meaning of big eaters? They are two system, that is liver and the spleen and the bone marrow. Bone marrow also have the macrophage system which eat this dead tissues. You can able to see this is the life cycle, okay, of red blood cells. We will see later on. Okay, this is the first thing. And the second, the old RBC are phagocytes and digested by macrophages. Already note done that macrophage system will eat all the dead tissues, mainly RBC. And the iron they contain is put to the blood to the return to the red bone marrow. So first step is macrophages ate RBC, but RBC have HB. In HB we have iron, iron mineral. So macrophages will eat RBC and destroy these cells, but it cannot able to digest iron because it is metal, metallic substance. So again, this iron will return to the bone marrow. Okay, bone marrow will again, it will collect and synthesize for new hemoglobin. So it is used again. This you can, so iron will utilize as HB. In the HB, the iron are connected to the molecules. Then again, HB will enter into the RBC. Again, regeneration of RBC will happen. If not needed immediately for this purpose, excess iron is stored in the liver. If we have normal iron in the blood, so what will happen? So the bone marrow will store the iron in the liver for future purpose. Okay, the iron RBC is actually recycled over and over again. The globule or protein portion of the hemoglobin molecule is also recycled. And again, we have another thing, that is in HB. HB also destroyed. But in the HB, we have protein, that is globin. Globin, that is the protein which also utilized. Okay, it is digested into amino acids. How it is? It is converted into amino acids. Okay, which may be used for the synthesis of new proteins, because globin also protein, HB is also a protein. So amino acids, it is converted into amino acids, regular amino acids, then it is utilized as protein. Okay, this is the thing we have to remember. Another part of the hemoglobin, one part is globin, another part of hemoglobin molecule is hem portion. Hem plus globin, hem one portion and B another portion. Hemoglobin, hem hemoglobin. Globin is utilized, but hem, what is the what the body does with hem? But it hem is not recycled. Okay, again we have to remember that. Again, I will repeat that we have RBC. RBC is destroyed by liver or spleen or red blood cells. Okay, because they have macrophages system. Okay, this is the one thing you have to remember. Second thing is that after microbases eat the RBC, they will remove globin from the hemoglobin and they remove iron. Iron is again enter into the red bone marrow. If it is in normal range, iron is normal range, you are eating sufficient amount of iron. So what will it will do? It will store the iron in the liver. Then come again to the HB, hemoglobin. Hemoglobin have two portion. One is hem and one another is globin. Globin is a protein. It is a type of protein. It is utilized by the body. Okay, by making its new protein. Another is hem. What does hem do? Hem is a waste substance. What is hem? Hem is an waste substance. So hem is converted into the bilirubin. Okay, who convert? Macrophages will convert the hem. Okay, macrophages will convert the hem into bilirubin. The liver removes bilirubin from the circulation and excretes it into bile. Bilirubin is a bile pigment. Bile is secreted by the liver into the duodenum and passes through the small intestine and colon. So bilirubin is eliminated in feces and gives feces their characteristic brown color. In the colon, some bilirubin is changed into the urobilinogen by the colon bacteria. Okay, here we have to remember, but some complicated things. That is that the hem is converted into the bilirubin. Who will convert? Liver will convert. First thing you have to remember. Second thing is the bilirubin will pass through the bile pigment. Who will release the bile pigment? Bile pigment is released by liver into duodenum, small intestine. You can see here. Okay, this is the bilirubin enter into the small intestine. So bilirubin and colon, again colon will remove the bilirubin and it will convert it into the urobilirubin. Okay, understood? Bilirubin till here small intestine it is bilirubin. After collecting with colon bacteria, it will be converted into the urobilirubin because urobilirubin will go to the kidney and it is removed from urine. Okay, some urobilinogen may be absorbed into the blood. This is the first thing, but it's changed into urobilin and excreted by the kidney in urine. If bilirubin is not excreted properly, perhaps because of the liver disease such as hepatitis, it's remained in the blood. This may cause jaundice, a condition in which the whites of the eyes appear yellow. This yellow color may also be seen in the skin of light skinned people. So you understood how the jaundice will occur. Okay, because of the liver damage, the bilirubin cannot be excreted from the body. It will remains in the blood and it will cause jaundice. So what will happen? Main the liver, if the bilirubin increases, the eye colors will convert into the yellow and you have yellowish color urine because of increase in urobilin. Okay, and the skin is light skin and it is the yellowish color. Okay, so these are the things you have to remember. Okay, again I will explain this circulation here. RBC is made in the bone marrow. Okay, and what it need? Iron need, hemoglobin need. Okay, everything you need to make RBC. So it will circulate into the body for 120 days, then again it converted. The macrophages, whatever macrophages were stored in the liver, spleen, and red bone marrow will eat this this red RBC. RBC again, it destroyed, and iron will come out from phagocyte macrophages, hem, globin. Globin again it utilized, iron also utilized and stored in liver. But hem is converted by the liver into the bilirubin, and again it have to remove from the body because it is a waste substance. So it will reach to the small intestine where it connect with colon bacteria and convert into the urobilin. Some bilirubin will remove from the feces. Some will, because of the urobilin, it will reach to the kidney, and after it is extracted from the urine. So this is the cycle. If what will happen if the someone doesn't pass the feces, or we have constipation, urine problem, what will happen? Bilirubin will store into the body. It will cause damage to the liver, or due to the liver damage, the patient is unable to excrete the bilirubin, and it will cause very excess diseases. Okay, understood till here?
Yes, sir.
Lifespan
Yes.
now. Okay, good.
Yes,
So
you understood.
okay. So basically, we talked about RBC because RBC have hemoglobin, hemoglobin have iron. Okay, basically, due to the decrease of hemoglobin, due to the decrease of iron, we will see number of cases like anemia. Anemia means low of HB. Mainly anemia concern low of HB or RBC. So let's talk about anemia. Anemia is a deficiency of red blood cells. So if it is less than 4.5, so okay. Iron deficiency anemia. What is iron deficiency anemia? Basically, there are different types of anemia. If the iron is decreased, we will call iron deficiency anemia. Okay. Iron deficiency anemia is caused by lack of dietary iron. So we are unable to take diet properly, iron diet. So that's the reason the person develop iron deficiency anemia. Or a person with this type of anemia may have a normal RBC count and normal hematocrit, but the hemoglobin level be below normal. So here, what will we will see low amount of hemoglobin, and as well as we studied iron and B12 and folic acid also responsible for the maturation of RBC. So B12 deficiency leads to pernicious anemia, in which the RBC are large, misshaped, and fragile. So, so that's the reason during pregnancy also folic acids, B12 are advised by the doctors. So because of the iron production or RB production will happen very normal range. Okay. So pernicious anemia means lack of vitamin B12. Lack of vitamin B12. Another cause of this form of anemia is lack of the intrinsic factor due to the autoimmune destruction of the partial cells of stomach line. Because stomach have partial cells, they absorb and digest the B12. So due to the lack of B12 also, lack of partial cells also, B12 cannot be absorbed. So this is also reason. Okay, this is intrinsic factor. Okay. So here next is sickle cell anemia. Sickle cell anemia is a genetic disorder of hemoglobin, which causes RBC to sickle, clog capillaries, and rupture. You can see thus this is the sickle cell anemia RBC. Because improper shape of RBC or RBC cannot be easily not matured. Mature type of RBC is not seen. Okay, because of disorder of genetic disorder. Okay, aplastic anemia. Aplastic anemia is suppression of red bone marrow with decreased production of RBC, WBC, and platelets. What is aplastic anemia? Uh, Neither RBC, neither WBC, neither platelets are produced. This is a very serious disorder that is because exposure of radiation, certain chemicals such as benzene or some medication. There are several antibiotics that must be used with caution since they may have this potential fatal side effect. So basically, some medications also cause aplastic anemia or radiation, mostly radiation. Like nowadays, radiations are very common. Everyone want to make X-rays, everyone take MRI, everyone want to say CT. So this is also reason for aplastic anemia. And second is medications. Unnecessary taking of medication is responsible for aplastic anemia. Okay, so I advise you that please guide the patients, okay, about these things, okay, because they don't know, okay, so why radiations are very harmful, why medications, self medications are very harmful. They will change the life of the person, they will damage the person. Okay, so please do this thing to every patient. Okay, my it's my humble request. Hemolytic anemia. Hemolytic anemia also disorder that cause a rupture of RBC before the end of their normal drive. So basically, a hemolytic anemia is the lifespan of 120 days. Before 120 days, the RBC will die, the rupture. So in this, that sickle cell anemia, RH are examples. Another example, malaria, in which a protozoan parasite reproduces in RBC and destroys them. It to destroy them. Hemolytic anemias are often characterized by jaundice because of the increased production of bilirubin. In malaria also, the RBC also destroyed by the protozoa. Okay, so these are the things will happen, okay, in anemia. Okay, understood. Next we have jaundice because it is related to RBC. We will study here jaundice. What is jaundice? Jaundice is not, it is not a disease. It is excessive of bilirubin in the blood because of the damage of liver cell. So it is the disease of liver, not a disease. So because of the hepatitis, infection of the liver, or damage of cells of liver, or cancer of liver, everything. This is called hepatic jaundice. What is called hepatic jaundice? There are other types of jaundice also, that is pre-hepatic jaundice and post-hepatic jaundice. Prehepatic means the bilirubin waste product formed from the hemoportion of the hemoglobin of the old RBC. Prehepatic jaundice means the problem is before the liver. That is, hemolysis of RBC is taking place at a more rapid rate. Rapid hemolysis characterized of sickle cell anemia, malaria, and RH disease of the newborn. They are hemolytic anemia. So this is very important. You have to remember that during after birth, after baby born, what will happen? Number of doctors tell he have jaundice. Okay, you have to admit the baby and you have to treat under the light. Okay, light. Okay. So why this happen? Because the RBC in the baby will damage rapidly because of the new production of RBC will happen and damage of RBC will happen. So that's the reason the bilirubin quantity is increased in the body. Okay, first 3 to 5 days it will happen. Then what will happen? Then the bilirubin is some mothers will take in, some mother will take to the baby under the sunlight. Okay, for the from the sunlight the bilirubin is it will excrete it from the skin or from the urine or from the feces. Okay, so some will give some medications. So okay, some will advise to kept under the light. Okay, so these are the things we'll do. This is the pre-hepatic jaundice, but it is improve. Okay, it will improve. Next is post-hepatic jaundice. It, and in some cases also the sickle cell anemia. It is also the rapid death of RBC will happen in malaria, in RH disease. Okay. Post-hepatic jaundice. What is meant by post-hepatic jaundice? It is a problem after the liver. The liver excrete bilirubin to the bile, which is stored in the gallbladder and then move to the small intestine. If the bile ducts are obstructed, perhaps by gallstones or inflammation of the gallbladder, bile cannot pass to the small intestine and back up in the liver. Bilirubin may be reabsorbed back to the blood and cause jaundice. Another name of this is obstructive jaundice, but it is not the fault of the liver. But after the liver excreted the bilirubin, there is a fault in the gallbladder, fault in the small intestine, any other organ. Okay, so that's the reason we will call is pre-hepatic, post-hepatic jaundice. Pre-hepatic means this is the fault in the another organ like bone marrow doesn't produce RBC, or RBC is rapidly dead, okay, or any disease is there which is killing the RBC like malaria. So in this also the liver is not helpful. Post hepatic also the liver is okay, but other organs causing damage, or other organs not excreting the bilirubin, okay. And hepatic jaundice is the real jaundice, and the other post and pre-hepatic jaundice are not related to the liver. So these are the things we have to remember. Tomorrow we will talk about blood types, okay. If you have any doubts you can ask.